Hey guys, welcome to another one of our videos in regards to having certain programs created in order for you to be able to increase your programs at the same time allows you to be able to differentiate yourselves to be able to gain more clients for your agency. Now, what we're going to be talking about here in this particular video is what we call the care plan oversight, and this is typically used for home health agencies. So if you're a home health medical agency, then these are things that you can add to your repertoire to be able to make sure that you make yourself stand out, especially when you're marketing your organization. Okay. So what is a care plan oversight program? Now, one thing that your marketers can do is that you can actually help physicians make sure that they are billing properly. We can never, ever, once again, ever give physicians and referral sources money. We can never do that. But one thing that you can do is you can actually help them and guide them, make sure that they're billing properly. We have what we call a physician care plan oversight. And in this video, we're going to be talking about care plan oversights for physicians. One thing that is important for you to be able to get more referrals is helping them make sure that they're making money or extra money for services that they provide. So one thing you can do is you can share with the physician and tell them, doctor, are you billing for all your care plan oversights? The physician more likely will say, yes, I am. Most of the time is the physicians will say yes, but at the very same time as physicians are caregivers, are healthcare providers. They provide the care. They're not the billers. They're not the ones that are putting everything in the computer. They're not the ones that are submitting things to Medicare, Medicaid, and to all the insurances for payment. One thing that you can do is you can tell the physician what we do is we want to make sure that every physician that refer patients to us always make sure that they're billing correctly, that they're not missing anything. So what you can suggest is that on a monthly basis for all the patients, for all the care plan oversights, you will actually give them a report every month of which patients that they provided care. And at the same time as you can make sure that you can give that to them to give the biller so that the biller can actually bill properly and not miss any money. This makes you stand out differently. Not all agencies or marketers do this, but what you're doing is you're going to be able to give that physician, being that home health agency that helps them with this, and help them understand. Now remember, educational-based marketing is one of the best things ever for you to do. You can come up with a report of what possibilities these physicians are losing, what money or what amount are they losing in a monthly basis if they are not billing correctly, especially for the CPOs. By you helping them and guiding them to be able to be more organized in billing these procedures, then you will be looked at as a valuable asset. So when we're billing for certification or recertification for patients, physicians should bill these services on their HCFA form. Nothing except the CPO or care plan oversight services are to be billed on those claims. So we will now call care plan oversights CPO just in short for now. So CPO services are to be billed only once per calendar month within 1 month services per line item. The claim must not be submitted until after the end of the month in which the services are performed or rendered. Dates of service entered on the claim form must be the first and the last day during which the documented CPO services are actually provided during that calendar month, not just the first or the last days of the calendar months in which the claim is submitted. Now, remember that medical records for those dates must have documents that 30 minutes or more time has been spent by that physician performing, including activities and services that were furnished, and the dates and the length of time associated with those services. Now, the appropriate codes must be used. You have your GO181, which is home care patient, or GO182, which is a hospice patient. All claims for CPO must contain the 6-digit Medicare provider number of the home health agency or the hospice that is rendering the covered Medicare services during the period of which the care planning was actually furnished. As with other Part B services, the patient is liable for a 20% copay when they are actually billed. Claims must be completed and submitted by the physician's office staff and not the home health agency. So remember this, you can help them and show them what they need to do, but you as a company, as a marketer, as an agency, cannot, should not, and will not bill for the physician at all. Okay, so let's talk about the initial certification. Physician certification of Medicare coverage services under a home health plan of care, including contacts with home health agencies and review of reports of the patient status required by the physicians to be able to confirm the initial implementation of the plan of care that meets the patient needs per certification period. Now, the appropriate billing code for these type of services is the G0180 and can only be used when the patient has not received the Medicare covered home health services for a minimum of 60 days. The service is billable once for the patient home health certification, period. Okay? This code will be used when the patient has not received any Medicare covered home health services for at least 60 days. In the exceptional circumstances when the patient will require a new plan of care to start a new episode before a 60-day episode has actually elapsed. Now, the physician certifying the plan of care would then report code G0179. Okay? So let's talk about recertifications. The physician recertification of Medicare cover home health services under a home health plan of care where the patient is not present, including contacts with home health agencies and review of reports of the patient's status, will be required by the physicians to confirm the initial implementation of the plan of care that needs the patient's needs per recertification period. The appropriate billing code for this particular service is the G0179. Remember, service billable once for a patient's home health certification period. This code will be used after a patient has received services for at least 60 days when the physician signs the certification after the initial certification period. If that patient is discharged, then subsequent resumes home care prior to the original 60-day episodes, the physician certifying the plan of care would report a G0179 even though there is a new start of care. Now, the best part here is that the physician care plan oversight, ever since 1995, CMS has allowed separate payments for physicians' care plan oversight. Services rendered to home health and hospice patients, the physician, not the home health agency or hospice, must bill for physician CPOs, care plans oversight services, right? They're billed under the G0181 for home health and G0182 for hospice. For services that may be needed for the care plan oversights will be ongoing review of reports, orders, treatment plans, changes in patient status, lab study results, telephone calls with other healthcare professionals involved in the patient's care, development and revision of healthcare plans, for example, team conferences, medical decision making, coordination of services that may require skills of like a physician, time spent on revision of the care plan after pertinent information has been actually conveyed. So services that may not be included as physician care plan oversights would be, services rendered to non-medical patients, post-surgicals within 1 month of surgery, the initial interpretation of labs, studies during, like, for example, a face-to-face encounter, services that are provided, where there's office visits, telephone calls to patients, family, or even pharmacy, even just to adjust medication or treatment, right? Travel time is not included. Time spent preparing claims, time spent on processing the claims, low intensity services such as that's like included in other evaluation and other management services, and also informal consults with health professionals not involved with that patient's care. And lastly, time spent discussing the patient with other office staff. So to be able to qualify for physician care plan oversight payments, that patient must have the following: The patient must be receiving Medicare covered home care or hospice services. The patient also must have been seen face to face by the physician within that 6 months prior to billing for that care plan oversight service. The patient themselves must require complex or multidisciplinary care modalities involving frequent physician development or revision that will necessitate a high level of a decision making and go beyond, just the basic functions. And of course, that patient must have complex medical conditions requiring intensive treatments, frequent determinations of responses to therapies, and also reassessments of the plan of care is needed. So, to receive physician care plan oversight payments, the physician must spend at least 30 minutes rendering care plan oversight services to each patient in a calendar month period, not have a significant ownership or interest or significant financial or contractual relationships with the home health agency as well. That physician must not be the medical director of that hospice or contract with that hospice to provide medical services, and also not be the physician providing services to rural health care clinic patients. So those are the requirements. Now let's talk about documentations. Medicare will require that physician who furnishes care plan oversight services, or CPO, they need to be able to document those services that were furnished. The date and the length of time associated with those services must be done. No presumptions are allowed to be able to support a claim that the sufficient time has been spent within a calendar month to satisfy the conditions of payment. Now, the Medicare program may conduct post-payment reviews of the claims for reimbursements of these type of services. For documentation, it must be adequate and support the claim that the services has been given of more than 30 minutes in the calendar month. Then, if that doesn't happen, it may be denied. The physician must be able to demonstrate to documentations and the patient records that at least 30 minutes were spent on oversight of the home care plan of care during that calendar month. The documentation must include dates and amounts of times associated with each encounter. The responsibility for documentation of care plan oversight activities lies within the physician and his team, although home care providers may provide educational information to inform the physician of this particular benefit, those who engage in these type of activities. You guys have to understand, this right here is such an important thing that you guys need to do. You as marketers, you as an agency should familiarize yourself with those different G codes that the physician can actually use. Like we said earlier on today, we cannot tell the physician or give the physician money, but we can help him make sure that he's billing properly. From what we have seen, that physicians who are actually seeing somewhere around 30 patients a month is losing about a six-figure income if they're not billing things correctly. That is money that is wasted because their biller doesn't know that they need to bill, or they could bill those things. Or maybe the team at the office doesn't have sufficient information to be able to take care of those things. Just because the physician's job is to sign these orders, that doesn't mean that that's already included. The physician can get paid for that. So I want you guys to start looking into creating a care plan oversight committee, a care plan oversight program, and able to provide these reports to the physicians. It's just another way to make yourself stand out. Like I said, we can't give them money, but we can sure as hell make sure that they are not losing money. This is just one thing that you guys need to do in order to be able to create yourself to be different from other agencies. Always remember, home health marketing is easy when you know what you're doing.